Welcome to the Aravind Operation Theatre, or OT for short. It's your first day in the OT and you're excited about your surgeries for the day. What do you need to do next? As you enter the second floor dress change room area, you will be required to take off your shoes and place them on the shoe stand. Then, sanitize your hands prior to proceeding to the changing room. Males will change into their surgical scrubs. Females will need to wear a surgical gown. Remove your watch and jewelry if any. You will then need to wear the surgical cap and mask provided in the changing room. If you need a locker for storing your valuable items like laptop, iPad, handbags, or jewelry, please contact our housekeeper for the locker key. Pick up a pair of slippers kept on the stand outside the changing room. Now let's proceed to the operation theater and start your OT day. Scrubbing procedures worldwide are standardized and an imperative part of infection control in the operation theater. They are essential to maintain consistent aseptic conditions, reducing infection risks and promoting patient safety. However, there may be minor variations at each institution. Now let's proceed to the hand washing station. At Aravind, you will encounter a 4-step scrubbing routine. Step 1. Wash your hands until above your elbow with normal water and hand wash for 30 seconds. Step 2. You will repeat step 1 again by washing your hands until above your elbow with normal water and hand wash for 30 seconds. Step 3. Wash your hands until above your elbow with RO, reverse osmosis water, and betadine solution for 1 minute. Step 4. Wash your hands above your wrist with RO water and betadine solution for 1 minute. This should take a total of 3 minutes. While performing your scrubbing routine, keep in mind the WHO protocol. 1. Wet your hands with water. 2. Apply enough soap to cover all hand surfaces. 3. Rub hands palm to palm. 4. Right palm over left dorsum with interlaced fingers and vice versa. 5. Palm to palm with fingers interlaced. 6. Back of fingers to opposing palms with fingers interlaced. 7. Rotational rubbing of left thumb clasped in right palm and vice versa. 8. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. 9. Rinse hands with water. Be sure to keep hands raised higher than elbows so the water will drip down your arm into the sink. Once you enter the operation theater, you will be greeted by the OT scrub sister who will hand you a sterile hand towel to dry your hands. Next, you will be handed your autoclave sterile OT cloth gown. Once you put it on, secure your wristbands and gown. Then, sanitize your hands again with the hand rub. Proceed to the sterile zone by crossing the red line. There, you will put on your sterile gloves. Be sure while operating only to touch the designated sterile areas. After your cases are over, identify the area of the color-coded bins and properly discard your gloves in the red bin. You will leave your sterile gown in the designated area in the OT, and after you change, you will leave your used mask and gown in the bins provided outside the changing room. Now you have the introductory tools to set you up for successful surgical training at Aravind. Enjoy your training experience.